Hi, this is a video that will teach you how to get a perfect smile both for the surgeon and for the patient. To get a perfect smile, you need to have a perfectly dry cornea, not too wet, not too dry. We need to have perfect centration on the pupil, very important. A perfect soft dock really adds. A perfect energy setting to give you the easy dissection of the lenticule and a perfect lenticular dissection. Often asked question is, why are drying? The dryness should be done maximally on the conjunctiva, again almost maximally at the limbus and minimally on the cornea. A very wet surface or very dry surface will give you insufficient energy penetration and poor dissection. A very wet surface will cause loss of suction and complications. The docking also is very important. One has to go very slow, not very fast. Touch gently, applanate about 80% and then switch on the suction. Once suction is switched on, the vacuum holds the cornea. Check for centration. Make sure centration is perfect. It's extremely important that the centration is checked, and if not centered, realign. Energy levels should be set ideally for each machine. You should have no feathering at the edges, no OBL. We are using energy offset of 24, a spacing of 4.5 microns, and a total energy setting of 120 nanojoules. Please remember, energy settings are individual to machines. One has to get used or find out the best energy setting for your machine. One indication that energy setting is perfect is when you go in, you have an auto decompression of the bubbles. We'll show it to you again. When you open up the side cut and lift, the whole bubbles in the interface just decompress. That's one indication that your energy setting is perfect. Once again for you to see the auto decompression. Once this is true, we are not going to open up and do first the anterior pocket should be dissected out. Very important to make sure you're on the anterior surface. Then do the posterior pocket. We'll show you here. Cut open the incision, go under gently, lift up and open up the anterior pocket. My technique is to open it up end to end. Once you're sure you're on the anterior pocket is opened up fully, go and delineate the side cut of the lenticule gently. Go under gently and stay on the right half of the incision and open up the inferior pocket. Do check more than once. You have the two separate areas, the superior and the inferior. Do check twice. Then take the spatula and go and separate out the anterior dissection plane. One has to be very sure that you're staying anteriorly. Then go under on the right side and separate out the posterior. Don't cut open the side. The superior separation should be made with a superior bias. Lift upwards with a spatula. Once again, to show that here, the superior dissection is made gently with a superior bias. One can see that the cornea is being lifted up and a gentle atraumatic sweeping is done. Once that is true, the inferior separation should be done with an inferior bias. Do not do this with a superior bias. You will probably tear the lenticule. Now go down into the side pocket, inferior pocket. Gently press downwards and atraumatically separate. Don't open up the edge. The edge has a different cutting characteristic, separating characteristic. Spare the edge. Once you have removed the adhesions in the base, in the posterior lamella, then you can go down and open up the edge. We'll show that to you in real time video. Once you're ready, go out and start the edge dissection at the lower end towards the right. Open up, gently open it up there. Leave a small island in between and open up to the left. Very gentle again. On the left, open it up fully. Now go and open up the island that you left. When you do this, the lenticule will not fold over or tear. Finally, the small bit that's left over at the base on the right hand side can be gently teased out. This technique is very safe, will prevent any tear of the lenticule or folding over of the lenticule. The lenticule is intact and separated, and it can be easily removed. Again, removal is intact. This technique is so very atraumatic and safe that one need not even check whether the lenticule is complete. So perfect smile starts with perfect drying, a perfect centration, getting a perfect dock, perfect energy settings, and a perfect lenticular dissection. Do use these techniques to get the best out of your results when you do smile. Thank you.